Greetings and welcome to the YouTube channel for Mr. Militant Negro. My name is JB, also known as the Militant Negro, and today I want to talk to you about Obamacare and the apparent increase in Obamacare costs that are just now hitting the United States of America. It appears that people who were happy about Obamacare and the low rates when it first started are now being hit with increases. Every state has a different type of increase. It's ridiculous. Texas Blue Cross stands out as one of the highest increases because they're going for an increase rate of 119%, according to Forbes magazine. Following them is Oregon, which has an increase of 38.5%. Then there's Tennessee. Their increase is 36.3%. Followed by Georgia, 14.8 to 19.4% increase. Then there's good old Iowa. They're asking for a 43% increase in Obamacare compliant companies. Followed by Kansas, Pennsylvania, and the list goes on. Washington State, Connecticut, Michigan, Vermont. Forbes has a listing for all these increases, and it makes you wonder if we were sold a bill of goods when we were told that the Obamacare, or better known as the Affordable Health Care Act, was a good, positive thing for us. It just appears that that's not the case. And, there are many reasons behind it. Many people are coming up with a whole bunch of different reasons why this is going on, but I'm hearing it's not a huge surprise. There have been signs for months that insurance rates would increase. And I can't help but understand increases in rates. But this Obamacare, or the Affordable Health Care Act, was put into place to limit insurance companies from price gouging its clients, us, you and me. And it was also put into place to help those who were too poor to get health care coverage on their own. So it makes you wonder, did Obama pull a fast one on us? Did he trick us? Did he play us for fools? Because it's not working out like he said it was going to work out. It's not appearing to do the things he told us it would do. It's almost a biggest failure as the website launch. And everybody knows what a clusterfuck that was. Okay, there was a way that this could have been a great thing. Everybody talks about Obama's legacy. Well, at present, his legacy is starting war all over the planet, lying to us about things, looking us in the eye and telling untruths and false tales, misrepresenting the things that he said he would do. Well, all he had to do to make the Affordable Health Care Act great was add single payer option. Single payer, what is that? Well, it's known as Medicare for all. It's a system in which a single public or quasi-public agency organizes healthcare financing. Even if it will remain largely in private hands, it still would help us out. We need help. It covers everything: reproductive health, mental health, dental, vision, prescription drug, medical supply costs. This is something that we need, something that a lot of politicians and a lot of people on the liberal and progressive front were pushing for when Obama put this Affordable Health Care Act plan together. Single payer option. It's something we need. Universal health care is available to so many nations across this globe, except for the United States of America. We don't care about universal health care. We don't care about free education. We don't care about those things because we want to make money. America needs money. They have to be able to afford sending $38 billion over the next 10 years to Israel. And that's B, billion with a capital B. They can't take care of their own crisis here at home because, number one, they got to pay money to Israel in order to remain Israel's bitch and keep Israel happy. Netanyahu has the biggest, and that's Netanyahu, has the biggest prick in the world up the ass of America. And Obama is enjoying that. Now, if we didn't send $38 billion in the next 10 or 20 years to Israel, we could build infrastructure repairs here in America. We could give our students free education, wipe out their student debt. We could institute universal health care for people who really can't afford to be healthy. You know what I'm saying? We could build homes for the homeless. We could get our veterans off the street who go off to fight wars, come back, and don't have a place to live. Can't find a job. All that stuff that's important for everyday living. If we just would take money out of the military budget, which is in the trillions of dollars, because we have to be prepared for World War III that we're trying to start, if we can remove that $1 trillion military budget and put it into food stamps, Social Security, keeping people safe on our streets from a militarized police force, retraining all those killer cops out there, put a Justice Department to work who's going to prosecute lawbreakers and keep law-abiding citizens on the streets from being slaughtered. We could use so much money to do so many good things, and the main thing is give people free health care. People need to be taken care of. Obama, he's got free health care for the rest of his life. Him, his wife, his daughters, mother-in-law, uncles, cousins, taken care of. Every politician in Washington, D.C., and those on the local level have adequate health care services. So why would they even be remotely concerned with the working class people, the middle class people, the people below the poverty line? Why would they care how you stay healthy? Ask yourself that question. You guys who vote in America vote to elect politicians. By far and large, all of them are millionaires. And if they're not millionaires, they're knocking on the door. Show me a politician in D.C., in the Senate, the Congress, Supreme Court, anywhere, who's not filthy rich. A common everyday guy like me or you has no chance in hell of being elected. You can just barely get in a statewide office. A national office? No, not going to happen. You need money. Campaigns are full of money. So we elect these people and put them in office to make decisions for us, to vote on bills for us that affect us, and they don't give a shit about us. That's our track record, which makes you wonder why the third-party candidates like Dr. Jill Stein and even dumbass Gary Johnson don't get a chance at a debate, don't get a real shot at running a real campaign to be elected to the White House. They don't have the money. We're too busy giving our donations to Trump and Clinton, when the people who really need our donations are Dr. Jill Stein and her running mate, Mr. Baraka. They need our donations. They need our help. They need us to put them in the Oval Office to make changes for us, because they come from us. They are us. They would give us single payer. We would have universal health care if we put people in the White House who give a shit about us. And I don't understand why nobody gets this. We continue to vote for the same status quo. Democrats, Republicans, same people, same party, same agenda. And you damn well better know that agenda is not fixing anything in Washington. Everything is broke. The GOP has already said they're not going to vote yes for anything if Hillary Clinton wins. So we're going to have 4 to 8 more years of obstruction, 4 to 8 more years of struggle, 4 to 8 more years of war. No infrastructure is going to be repaired. Social Security could very well go bankrupt. So all that work you've done all your life, saving for retirement, you got to get your ass up and go back to work every morning because you can't retire. SNAP, which is supposed to benefit poor mothers and families who can't make enough to get food, that's already been gutted and cut and messed with. WIC, Women, Infant, Children Program. Who in the world would cut that program? Newsflash, it's been cut. Healthcare. Let's get back to healthcare. We all thought that Obama was the savior. We all thought that Affordable Health Care Act was going to be the magic ticket. Turns out, another lie. It's just not happening. Your increases are rising. They're coming. And they're not going to stop with 2016, 2017. Once an increase is accepted and people don't say anything, people don't boycott, people don't raise up and stand up against it, it happens every year. The insurance companies are too big to fail or jail. They get away with murder. Nobody cares. We don't even care. I don't know what to tell you guys except we need to stop this. We need to find a way to come up with politicians who care about us. We need single payer. We need to be on the streets protesting for single payer. Everybody's running around here all upset and pissed off because there are increases in Obamacare coverage prices. You knew they were coming. We were told they were coming. Robert Reich, an economist, told us exactly what was going to happen down the road. Even sellout Bernie Sanders was out there stumping for single payer. I don't see Hillary Clinton talking about single payer or universal coverage. I don't see Donald Trump talking about single payer or universal coverage. And I definitely don't see dumbass Gary Johnson, who can't even tell you what Aleppo is. He hasn't opened his mouth about health care. So what do, people? What's the solution? I mean, let's be honest. Health care is the single most important thing there is. You got money, but you can go broke trying to have good health. If something happens, you get hospitalized for an extended period of time, your wealth gets eaten to death. Rich people get cancer. Rich people have heart attacks. Rich people get terminal diseases. They have to spend their money. Most of them can do that. But even they deplete their money down to zero. So what do you think the chances are of you and I, who are not millionaires, billionaires, some of us ain't even thousandaires? How do we take care of ourselves at a young age when things can happen, at an old age when things are bound to happen, and when we get elderly where we need medication? It becomes a choice between medication, rent, food. How do you make that choice? How do you decide every month? Am I going to pay this bill? Am I going to get this cut off? Am I going to pay this utility? Do I get this pill? Do I skip that medication and just get this medication? Can I afford not to get my insulin this month? Heart attack medicine, can I get that? Do I have to pay rent, or do I have to move in with my aunt? Move in with my daughter? Become homeless and live in a shelter? How can I survive? Now you want to tell me I got to pay health insurance that runs into the hundreds of dollars every month. How can that be accomplished when you just don't have it? Social Security, even though it's working, it's a joke. There are people surviving on Social Security for $500, $600, $700 a month. How do you do that? How do you live off that? SNAP benefits were cut when the government shut down, and they never put it back to where it was. I know some people in America who get $16 a month in food stamps. Tell me what you can buy with $16 a month in food stamps, and you make $700 a month from Social Security after working all your life. It's an impossible situation. You can't add health care increases on top of that. Nobody can survive that. The 1%, they do fine. The 99%, they're not surviving. They're not even really living. And we don't care about this. We want to talk about the Kardashians or Duck Dynasty or Dancing with the Stars or what some damn housewife in buttfuck New Jersey's doing. People, we got to wake up. We got to help each other. We got to vote people into office who care about us. Repeat it after me if you can. Single payer, universal health care, free college education. It's simple. Single payer, universal health care. Get Obamacare out of there. Get Obama out of there. Don't put Trump or Hillary in there. Namaste, people. Have a good week. Stay safe. Be well.